Hi, my name is Ryan. I'm a student at Nightingale College. Today I'll be performing the skill of inserting a sterile procedure of inserting a female catheter on a female patient. First thing I'll do, I'll knock on the door. Hi, Miss African. I'm Ryan. I'll be your nurse today. I'll close the door behind me, make sure you have privacy. I'll do hand sanitizer. Hi there, can I check your wristband? Tell me your first and last name. I'll verify it's the correct patient. I will put on gloves. So today we're going to be doing a catheter on you. It's going to be a sterile procedure. It's going to involve me touching your private areas a little bit. Are you comfortable with that? Okay, good. First thing I'll do is I'm going to have to clean the area. I'll put you in a comfortable position, lying supine. Let's be lying on your back, and I'll have you spread your legs, and we're going to have your knees facing out and your feet facing out, kind of like how a frog looks. All right. So once I've got her in that position, legs spread, frog legged, I'm going to lift your blanket up. Okay. Blanket's up. All right. You're gonna feel me touching. I'm going to be touching the perineal area. I'm gonna spread the labia. I'm going to grab my cleaning materials. I've got two, one for cleaning, one for drying. I'm going to be starting farthest away from me, anterior to posterior, and then closest to me, and then down the middle for both cleaning and drying. All right, you can feel me cleaning. It's going to be soap and water. I'm going to clean top to bottom. Farthest from me, alternate, so it's another clean side, top to bottom, and then down the middle on a clean side, top to bottom. I'm going to dispose of that. I'm going to grab the drying one. I'm going to do the same thing, farthest, closest, and middle. Anterior, posterior, I'm going to be just dabbing, not wiping, so we don't hurt the patient. I'm going to alternate, anterior, posterior, side close to me, and then down the middle, anterior, posteriorly. I'm going to dispose of that. All right, I'm going to get my sterile field set up. I'm going to take my gloves off. I'm going to grab my sterile kit, my unopened sterile kit, a brand new one. Open it. I'm going to lay it here between the legs. The bag is going to be my trash bag. I'm going to set it up away from the sterile field so I can throw away some of my garbage that I've used. I'm going to open it up one side at a time, and the last one's going to go towards the patient. I'm going to get my sterile gloves out. I'm going to lay them out in a clean flat field, and I'm going to don the gloves using the sterile glove procedure performed in the previous video. On, fingers in. Glove. I'm going to set up my field here. I've got two different layers here. Both have a shiny side and non-shiny side. The shiny side is going to go towards the patient. That's the water resistant side. I'm going to open up and shake it open. The shiny side. I'm going to turn it wrist in towards me. Miss Appleton, can you lift your hips up? It's going to go under your butt. All right, just going to lift your hips up. I'll slide under the butt, still keeping a sterile field. Next one's going to go in the perineal area. It'll be unripped. The shiny side is going to go to the patient. There you go. And I'm going to get the rest of my stuff set up. I've got my urine cup. I'm going to make sure that is loosely on. Put my tray out here between the legs. Got my 10 cc syringe. I'm going to remove the cap. I'm going to get my alcohol wipes out. They would normally be betadine, but we're using alcohol for this procedure. And open up my lubricant. Get the lube in the tray. And then I'm going to remove the sheath from the catheter here. And the tip is going to go into the lube. And then my 10cc syringe is going to go into the hub of the catheter. And that's what we use once we have urine flashback. We will insert the saline into that and expand the balloon so the catheter is stable in place. All right, you're gonna feel me touching, you're gonna feel some cold again, okay? So I'm going to spread the labia, take, clean farthest to closest, anterior, posterior, and throw that away. Anterior, posterior closest to me, throw away. The last one's going to go down the middle. I'm going to be looking for the wink of the meatus. That's going to be my target. Anterior, posterior, throw it away. I saw the wink. I've got my target. I'm going to grab 2 inches below the tip where the lubricant is. All right, Miss African, I'm going to have you take a deep breath and then breathe out. When she breathes out, I'm going to insert the catheter into the meatus. Once I see urine flashback, I'm going to hold the catheter there. I'm going to advance another 2 inches after I see flashback. And I'm going to, while holding that, I'm going to push the saline in. That's going to expand the balloon. I'm going to remove it, dispose of that. That's going to keep the balloon there. I'm going to slightly pull back on it until we get resistance. That means it's stable and secure there. I am going to then tear my field here. I'm going to clean around the peri area with the clean side. I'm going to remove my field. I'm going to attach, I'm going to move all this first into my trash that will be next to me. I'm going to attach to the leg so it's secured by the device that comes with it. I'm going to hang the catheter below the patient. I'm going to make sure they're comfortable. Are you comfortable? We'll lay it back. I'll cover them up. I'll dispose of my stuff. I will perform hand hygiene. I will document what I've done, and voila, we've done a catheter.